Thank you, Mr. Speaker. I'd like to move away from culture of corruption to the culture of fear and intimidation. Last Friday, the Health Minister continued his tradition of bullying Albertans' physicians when he reneged on the agreement of principle that he signed just before the election, that he walked away from negotiations, and he unilaterally imposed a contract. The President of the AMA calls this Minister's actions a frontal assault across the board and another form of physician intimidation. To the Minister, you've had a weekend to think about your mistake. Will you do the right thing now and rescind your heavy-handed approach and get back to the negotiating table?
Honourable Minister of Health.
Well, Mr. Speaker, as the honourable member knows, this government has been in negotiations with the Alberta Medical Association for over 20 months now. Alberta has the distinction, and we're proud of it, Mr. Speaker, of providing the best pay in Canada for our physicians at 29% over the national average. The offer and the increases that were announced on Friday extend that by an additional $463 million over 4 years, Mr. Speaker. This is a very important development that will provide stability for physicians and their ability to plan after a very long period without any knowledge of additional monies coming their way.
Thank you, Mr. Speaker. While the doctors have been negotiating, you've been busy changing leaders, deputy ministers, and ministers. Given that there's a major shortage of family doctors in urban, especially rural Alberta, and that the physician retention benefit and office cost programs keep experienced practicing doctors practicing longer, why is the minister going to make this crisis much worse?
Honourable Minister.
Well, Mr. Speaker, in addition to paying our doctors the best in Canada, and we believe we have the best doctors here in Alberta, the honourable member should also know that Ontario physicians are facing a fee cut and that the additional funds that were announced on Friday exceed the recent deal that was entered into in British Columbia with their physicians. With respect to the two programs that the honourable member mentions, he should know that $120 million is earmarked and will stay earmarked to support family physicians in practice in our primary care networks, in our family care clinics, and in physician offices.
Honourable member.
Mr. Speaker, the doctors of Alberta don't know what this guy is doing.
Exactly.
He didn't talk to them. He just walked away from them. They had to read about this in the newspapers. Given that, to the same minister, given that this minister has completely lost the confidence of the physicians of this province, the AMA, and the public, and has proven that he's not a responsible leader, Minister, will you resign? Will you resign, Minister?
Honourable Minister.
Just say no.
Just say no. Mr. Speaker, as usual, the gap between what this honourable member knows and what he thinks he knows continues to widen. The fact of the matter is, Mr. Speaker, this is a very generous financial offer to our physicians. We will continue to work with them in order to improve the allocation of physician compensation resources within our global budget. We're anxious to begin that work. I've had some very constructive discussions with the new president on how we might go about that, and Albertans can remain confident, Mr. Speaker, that we will work in close collaboration with our physicians to improve the system.